Hello and welcome to Catalyst for Healing. I'm Dr. Yannick. I'm here with Maria Lloyd, a therapist. So today we are going to talk about how to prepare for a ketamine treatment. So we're going to focus today on ketamine infusions, which is like an IV form of ketamine because it's kind of the extreme end of the spectrum in terms of the various routes of administration for ketamine. You can go back to our third podcast if you want to see the differences in the routes of administration. But we're going to focus on how to prepare for an IV ketamine infusion. We're going to start with it from a therapist standpoint, when a patient is speaking with their therapist, kind of maybe the day or two before a ketamine infusion. And then we're going to kind of flip it and go to myself as the physician, how I'll walk a patient through how to prepare for their first ketamine infusion, and then obviously all subsequent ketamine infusions. So, to start with, Maria, I'm going to pretend to be a client, a brand new client that you've never met before.
Okay.
Obviously, we're going to try and not get into too much details, but I want you to help walk through how you would talk to a patient about how to prepare for an experience.
Okay.
Okay.
We got to switch our chairs a little to get into the
neither of us are actors, and so this might be weird, but we're going to give it a try.
All right.
Okay.
Well, welcome, Justin. It's really nice to meet you.
Nice.
I know we talked on the phone a little bit.
Yeah, thanks. So I have an IV ketamine infusion scheduled 2 days from now.
Okay.
And they told me to meet with you to discuss what I should know.
Okay. How are you feeling about it?
Really nervous.
I bet.
It sounds like a really scary thing to do.
It is scary
Yeah.
for the first time. And so my job is to kind of help walk you through what to expect.
Okay.
And that will bring some level of calmness going in, hopefully. Sure. So you have a chance to ask any questions you want.
Yeah.
But just to start with, what are you most nervous about?
I think the lack of control. It seems like It's something that I'm not going to be able to control where it takes me, and that makes me nervous.
Yeah. Well, that is probably the number one thing people are nervous about, the lack of control. So how is that showing up in your life right now?
Now it's about to get real.
Yeah.
This is when the role playing actually translates into real life. Well, I think most of my day-to-day existence is all about me exerting control over everything, and that's how I feel comfortable and safe. And so the thought of doing something like this really scares me.
Yeah.
Because I feel like I'm going to not have control of where my mind is, and that's the only thing in my day-to-day life I feel like I do have control over.
Okay. So that would be scary.
Yeah. Is that okay?
I can tell your body language is showing
that. Do people say that?
This is, again, the most common reason that people don't want to do it is because they're afraid of losing control. They're afraid of what's going to happen to their mind.
Yeah.
So just to put you at ease, this is a very gentle, very mild dissociation. So the entire time that you're going to be sitting in a chair or something kind of reclined. Once you get the medicine, it's about a 40-minute dissociation is what it's called, but it's not like you're out of body completely. Like the whole time you can tell that you're in your body, you just feel more of like a floaty sensation. And for the majority of people, the medicine gives this experience of everything's going to be okay, and just kind of a peaceful, loving experience while you're taking the medicine. And then you're going to kind of maybe see some colors or shapes or kind of a dreamlike state. You're going to maybe see images of things, but it's all very gentle and very calming.
But what if something really scary happens? Like what if I have a trauma as a child and I am in that moment again? Like what do I do then?
Well, that's a really good question. And I think what we need to do is consider the first one is going to be at a little bit lower dose. It's just an introduction to the experience. So I've never seen a lot of trauma open up in that first infusion. And that's something that we kind of tread very carefully as practitioners, because we want to make sure that the therapist and client has a relationship, so they're prepared to work through what's coming up a little bit at a time. So I would say for right now, for everyone, anxiety is about the future. And so what we want to do is just think about how can you prepare for that first session? And does that feel comfortable if we think about it as just preparing for that first session?
Yeah. I think the biggest concern I have though is like what does happen if I do go to a scary place?
Okay.
And like I've never done anything like this before.
Yeah.
And like how do I know I'm gonna come back? Like I know people can go crazy and things like that. Like
okay.
Yeah.
It's a great question. That's where this medicine is very monitored by the dose, and you're going to have a nurse there and another practitioner there to help you. If you get scared, they can slow down the IV. If you need to, if something happens, they can always stop the process. So that's the benefit of the IV, is it's very slowly going into your bloodstream, so you can always stop the process if it gets too scary, and you're being monitored the entire time.
So what do you recommend, if my infusion is in 2 days, like the night before or even the day of, like what can I do to get the most from it or be ready for it?
Yeah, that's a really good question too. So let's go back to what you were saying, the fear of letting go of control. So if we just use that as what's coming up in the moment, because we want to get connected with what's live and active in the moment, and then create an intention going into the infusion of something that's completely opposite of what you're dealing with. So if your struggle is control, losing control, maybe a good intention would be surrender, letting go. What do you think?
Yeah, that makes sense. But when you say intention, what does that mean? Like practically, what does that mean for the session?
Well, we want to just kind of have a focus on what the intent is that we want to feel and experience. So let's say you go in wanting to just learn how to let go, learn how to surrender. If that's your intention, then we want to maybe think of some meditations you could listen to before that are all about, there's so many meditation apps where you can just search surrender and then find one that resonates with you and really ground yourself in surrender, because that's going to give you a sense of calm. We can pair that with some breathing techniques to get you really calm and grounded, because we want to approach going into the session from a really calm, grounded space in our bodies. So if our bodies are dysregulated, it's going to be more difficult to surrender and let go.
Right. So when you say like something like surrender, let's say I'm doing meditation, during the experience itself, am I saying the word surrender, or what is that? Am I just feeling it? What does that mean?
I think it's, what I tell everyone is just the preparation is going in with that intent. And then you want to just let go and see where it takes you. Okay. So you don't want to keep like forcing it to be about surrender, because we don't know where the journey is going to take you once you're in there.
Yeah.
But you're preparing yourself that this is something you need more of in your life. So you're opening the intention up to have an experience that's going to teach you how to let go. And sometimes that makes a big difference in how you experience the journey.
I see. Now, what if during the experience I have something really important that comes up? Like, how am I going to remember that? Like, what if I don't remember that?
Okay. So you have a couple options. You can videotape and ask permission to videotape your session so you can watch it back. Or you can ask the person that's there with you, the nurse, to write down what you're saying. A lot of people don't say anything, so it just depends on the person. But if you're thinking of something, we always have journals right after, so like immediately after you can write down whatever insights come up.
Okay.
And that way it'll be like fresh, you know.
Okay. All right, that's seen. I think for now, because we're going to try and just do the pre-stuff. Is there anything else that you would typically recommend to a client? I mean, of course, we're cutting out the whole normal intake process that you would have and all that stuff, but just kind of like the general, this is like very general advice you give. I think there's a lot of really good stuff there.
Yeah.
Is there anything else you feel like I missed that people often ask you about or that you recommend to people?
You were hard. I was like, okay.
I'm trying to think of all the stuff that
No, it was good. It was good. Most clients come in and they don't know what to ask.
Yeah.
So I'm kind of more prodding and trying to say, well, what are you afraid of? But I think I just like to really help them recognize that it's a very calm and loving experience. Like I can't get that across enough, because everything you hear about the word psychedelic triggers all the history of psychedelics and what they've meant in the past.
Right.
And so that's just something I'll spend time understanding, like what is their perception, and getting into that, because we often need to like shift to what's really going to happen rather than what their perception is.
Right. It's hard because it's like, I think we simultaneously tell patients every experience is going to be different and we can't say for sure what's going to happen, right, during the experience. But then we also tell them to embrace that this is going to be, it's positive and loving and meaningful. And it's like, it's hard. I've had this conversation with patients where they're like, how can it be both?
Right.
And I think that is kind of the unique, it's the dichotomy of this space is really some of the most meaningful things that can happen are things that can be maybe on paper look negative or look sad or look difficult.
Yeah.
But like, that's why you're here.
Right.
Right. And so I don't think we're misleading patients by telling them that on the whole it's going to be, there's usually on the whole it's positive and love and euphoria and just today, patient that was like it just was heaven. He's like, I felt like I was in heaven. Wow. Right? And like that's, of course that's not everyone, but on the whole it trends that way.
Yeah.
I don't ever want to set an expectation of like this is where it's going to go, but I think it's important for people to not be like scared of this, and that's
the big piece.
Like there's a lot of fear
that
goes into this, and I think I've spoken to so many at this time that's usually, especially the first one, they come into the office and it's so obvious on their body that they're nervous.
Yeah. I didn't answer your question about the night before.
Yeah, go into that. Yeah.
Okay. So I try to have people, one, stay away from triggering events, anything that's possibly triggering, which often includes social media, television, news especially, but also toxic people.
Yeah.
That's a big one. And so, I try to say, like, we need to think of this 3 weeks, because they're committing to 3 weeks as a healing container. And you want to create spaces at home. You want to go to nature as much as possible during this time, because nature is soothing our nervous system. We know research about grounding and all of that. But I think what we need is sorry, I lost my train of thought.
Okay. You're talking about the important things to do before the infusion. And so the night before, I think, is a critical time.
Yes.
Right? And I think I think it's important to not put too much pressure on it, because I'll have patients come to me be like, oh, like I just got in like such a big argument with my so-and-so, and like I don't know if I'm ready to do this. And first of all, that's okay. You don't have to do it right now. Right? This is never set in stone, and things can move around.
Right.
But we also have to acknowledge that you're in the real world here, right? You're not at a retreat in Costa Rica where nothing else is going on.
Yeah, right.
So it's a balance. There's obviously the ideal of like you go home and you're sitting under a tree for 12 hours and you're being fed fruit. Like, perfect. But like that's not the real world here.
Right. A lot of people are still working.
Totally.
And watching their kids.
Yeah.
And so it's like stretching that out a little more than they would.
Yeah, some intentionality to it.
Some intentionality of like canceling those extra things you have in your schedule. Try to just make it a little more peaceful.
Yeah, I hear you. And so like day of, for example, I think this would be more, I'm going to defer this one more to you, but like patients will ask us, is it okay if I work the morning before my infusion?
Yeah.
What would you say to that?
I think, well, definitely the morning before it could be okay. I mean, it's better to not be working on the infusion days, but
Sorry, that's what I meant to say, infusion day. So let's say
Yeah.
a patient has an infusion at 2 p.m. and they want to work in the morning. What are your thoughts?
yeah, I mean, it just depends, right?
Mhm.
It depends what kind of work, how much,
Yeah.
what the stressor is of that. Definitely not after. Like
Yeah.
that one is for sure.
Sure, totally. And we'll go into that on the next episode, kind of the stuff afterwards. But I agree. I think it just depends, right?
Yeah.
Like we have to acknowledge here in the real world, you know, if you have obligations, you got to do it. It's what I find remarkable about meditation as a whole is it can be done in a minute. You can reset
Yeah.
yourself so quickly. And so I think if in the days leading up to the infusion, you kind of find something that works for you. Insight timer, for example, is one that you've shared with me that I really
Yes.
like, and we actually started to use in our clinic.
Yeah.
They have 2, 3, 5-minute meditations that we actually use before an infusion to kind of get people in the right headspace. But something as simple as that, you're on your way to the infusion, you know, assuming you're not driving to the infusion, which you shouldn't be, put on the meditation, start to get into that right space, like remove yourself from the noise of the day that you had, and try and kind of ground yourself into what you're about to do.
Yep.
And when they come into the clinic, you know, that's kind of where ideally everything is left behind. This is your space to heal.
One thing about meditation is 99% of the clients that I see have such a hard time meditating because their nervous systems are so dysregulated.
Yeah.
And they're just in that constant fight or flight. So if meditation is difficult for people, I often then recommend doing breath work.
Sure.
Because that's so simple in terms of just focusing on the breath, maybe breathing numbers, 1, 2, 3, breathe out, 1, 2, 3,
Yeah.
physiological sigh, anything that just calms the nervous system.
Yes.
And that's where, being in nature can be helpful to reset the nervous system a little bit. So even just go outside and look at a tree or anything that can be calm and grounding for your body, because when you're in that fight or flight, it's going to be hard to go into the ketamine session and not, and to be
That's true.
open.
Yeah, and I think don't underestimate how little time that could take to
Yeah.
get to that level. Like we've had patients at one of our clinics where just a couple minutes they'll sit under a tree in the sun and just take a beat.
Yep.
Meditation is I think it's such a loaded term, and I think a lot of people it's a trigger word for them.
I know.
Because I think everyone recommends it. But yeah, I think what you're saying is great about breath work, and I think meditation doesn't have to be sitting with your legs crossed, eyes closed, fully empty, right?
No.
It's just being intentional about removing yourself from the noise, and you can still be having thoughts, and that's okay. It doesn't mean you're not meditating. You're just trying to be present and mindful.
Yeah.
And so I think let's transition. So now from a medical standpoint, we don't necessarily need to do the role play thing. I think I can briefly, just because mine's a bit easier, honestly. I think this is why it's so important to work as a team, where my job when it comes to the patient coming in is really to make sure that the conditions are medically optimized for them. So that the experience, number one, is safe for them, and hopefully number two is, ideal, they get the most out of it.
And by the way, your clinic is unique in offering the type of support it does when a client comes in. So the reason we wanted to do this preparation was for people that are going to clinics that might not have any prep or preparation included. So these are very simple things you can do for yourself. There's also a free app called Field Trip, and they were the original founders of CAP therapy, and they have some wonderful resources on there in terms of music, meditations, any types of ways to prepare. But just
I can link that. There's also the MAPS workbook, which I can put in the link as well, that I think is great as well.
So just know you can do all these things yourself to prepare if it's not something, because there's so many clinics across the country and some might not have as much, but you will get more out of it if you do a little bit of preparation.
Absolutely, and I think we're trying to give an idealized version of things and take what you feel is right for you and what's practical for your own situation. So when it comes to the medical side of things, I think first thing is, obviously I've done my intake. So assuming that they're safe to proceed with the ketamine infusion, number one question I always get asked is, can I take my medications?
Okay.
Yes. So if there are any medications that we feel are either would blunt the experience or are dangerous for the experience, which are very few, the doctor will communicate that with you ahead of time.
Yeah.
So I think it is always err on the side of taking all of your scheduled medications, and the worst case scenario is if the doctor finds out during that day that, oh, I forgot to tell you not to take this medicine, you'll have to reschedule. But you should never be stopping medicines without a doctor's advice, because that can be dangerous as well.
Right.
There are certain medications that can blunt the experience. The experience itself is not everything. It is not necessarily predictive of how you're going to respond to the medicine. But I do think there's a lot of just value in the experience. And what I mean by experience is like what you feel during the infusion.
Yeah.
And so benzodiazepines, common ones being like a Xanax or Ativan or Valium, things like that, which are really common with, our patients with anxiety. A lot of them take it usually as needed, rarely scheduled. But we try and recommend against it. Let's say there's someone that takes it 3 times a day. We say, okay, that morning of, if you can avoid it, that'd be great. Most, if not all, clinics should have a benzodiazepine in clinic that they can give either IV or oral, so if you need it, they have it. But the benzos as a whole, that class of medicine, can make the experience less intense. And I think with that comes maybe not as significant of an experience. I think it's safe to say. I don't think it's predictive of not getting as much efficacy, but the experience isn't going to be as intense. Other than that, really, like no medicines that you like absolutely cannot take unless they're communicated to you with the doctor, and they're really kind of rarer medicines, and so I would just defer to your doctor and ask them about all your medications. Now, when it comes to food and water, I would say the vast majority of clinics are recommending no food 4 hours before the infusion. That can be really hard if you have like a morning infusion. So if you're someone that wakes up later in the day, like myself, like I'm someone maybe at 8 a.m. kind of person, 8 or 9 a.m. kind of person. The idea of waking up at 5 a.m. to have breakfast just sounds terrible. And so I think with that, getting an infusion that is maybe in the afternoon might make more sense. So you get a breakfast, you don't feel like you've been fasting for a long period of time, and maybe have the side effects that come with fasting if you're someone that eats regularly like I do. So I think,
And by the way, the 4-hour fast is also for the sublingual and the nasal.
I think that's pretty standard
universal.
across the board.
Yeah.
You'd be hard pressed to find someone that goes less than that. And the reason we do that is because ketamine can make you nauseous. And the last thing we want to do is have a full belly and throwing up in the clinic, because that can be not just disturbing, but it can be dangerous, right? You could aspirate on that and stuff like that. And so obviously we mitigate that risk by giving everyone Zofran during or right before the experience, but we try and really mitigate the risk as much as possible. So empty stomach is ideal.
Okay.
Now with fluid, we're a little bit more relaxed with that.
Mm-hmm.
We say you can have small sips of water up until 2 hours before. Really, you can drink as much as you want up until 4 hours before, but it's so hard to go 4 hours without even small sips. And to be honest, when patients take the Zofran tablet, and oftentimes they don't like the taste of it, like a small stick of water, like that's okay.
Yeah.
At the end of the day, it's a cost-benefit analysis for the patient, and we can have that discussion with them. I think the risk is really low. Okay, so that's kind of the food type thing. Now, other things to know, kind of preparing for your first infusion, is you're going to need a ride. And all clinics should communicate that with you, but you'd be surprised how many times patients, I think because there's so many other things going on, they forget this.
I know.
And so if you're going to drive yourself to a clinic, you better have a way to get home, right?
Yeah.
And so you can do, ride shares. Some clinics allow that. Others require you to have a family member take you home. But you are absolutely not safe to drive after an infusion. Even if you feel clinically sober, you are for sure not safe to drive.
So how many hours after would you say?
Yeah, we say 12 hours.
Okay.
To be honest, you probably are going to feel really sober 4 to 6 hours afterwards.
Yeah.
But I think erring on the side of caution, 12 hours, given the half-life of ketamine, I think that's most clinics are saying 12, maybe some are doing 24, but I think practically 12 is reasonable.
Okay.
So if you're doing an infusion in the afternoon, it would just mean the next morning you can drive and stuff like that. I think 24 hours is pretty prohibitive if you have people that are like working and stuff.
Right.
Before the infusion, the other question that we oftentimes get from a medical perspective is, my blood pressure and things like that. And so if you're someone that has a higher blood pressure, if you come into the clinic and it's and it's elevated, we'll try and calm you down, because a lot of times it's going to be artificially up. We'll have a patient lay down, eye mask on, 5 minutes of some breathing, things like that. Maybe collect payment.
Can you say what the blood pressure parameters are?
Yeah, I mean, it's hard to say, to be honest. I think most clinics would say if the systolic is above, I think probably, I'm trying to speak for everyone generally, 150 to 160, if it's above that, probably would not proceed. And if the diastolic is above, probably 95 would not proceed.
Okay.
If I'm being honest, as an ER doctor, those numbers don't scare me at all. Like, those are very normal numbers in the ER, but I think we're in an outpatient clinic doing a very elective procedure. Elective is a loaded term, but I don't even like that term. I take that back. This is not elective. These patients need this. But ultimately, our number one job is to cause no harm, and so we try and err on the side of caution. If their blood pressure is above, for us, if we usually say they're above 150, 160, and it's persistently that high, we're not going to proceed. We'll have them come back another day. The reality of the infusion is your systolic blood pressure is going to probably go up by about 20 points, the top number, and the diastolic, the bottom number, is going to go up by about 10 points. That's like on average. And so if you think about it, like, it's not a significant jump, and after the infusion, it's going to go back down pretty quickly over about an hour. So that's kind of it. Like, my job from a medical perspective, preparing them is a lot easier. I think that's why it's so critical that they have that session or two with the therapist. I think lots of places do it differently. Some, like, for example, you have patients that you've been working with for years that then you recommend doing ketamine infusion. That's a very different dynamic than I am referring a patient to you that then you see for 1 or 2 sessions and then they come to a ketamine clinic, but that's kind of the nature of this. Is there's a lot of patients that have not wanted to do therapy for many years because it didn't work for them, and this is kind of their gateway to engaging with therapy.
That's very true.
Okay, is there anything else you feel like we've missed on this?
Well, we were going to talk about music.
The
importance of music.
Cool. So I mean, music's critical, both before and after, to be honest. During the experience, maybe you can explain, what do you feel like music adds to the experience for you?
Well, I know there's a ton of research. You probably have more information. We could put something in the show notes.
We'll just do a whole podcast on music, but let's just
introduce it now. I think, the types of music is generally like, there's again such a variety, but a lot of emotion is happening in the music. So it feels like it's guiding you. I think we all call this a journey, and so it's guiding you on that journey, whether it's like, I don't know, calm, and then all of a sudden it gets more intense. And so there's something about the music that really, it does play a big role in the process.
Massive role, So I think there are going to be some clinics that have preset playlists for you. Now, again, we're talking about if you're going into a setting, like a clinical setting, that will have some playlists for you. I think it's great to ask them ahead of time to share those playlists with you so you can listen to them and see which one might resonate with you. I think it should almost be required. I think it's a really good thing to have an understanding of what the music's going to be like, because sometimes it's really not going to resonate with the patient. You don't want to find out during the infusion. And most of the playlists are usually on like a thing that's like Spotify or Apple Music or something like that. Another thing is, if you're making your own playlist. Again, I really do think we can devote a whole episode to this because there's a lot of cool research on it. But number one recommendation, if it's your own playlist, is to make sure the songs don't have lyrics.
100%.
I think that's like, there's a lot of other things, but that is the most important. And I say this as someone that loves all types of music, especially music with lyrics, but like, it is going to take you out of the experience. And I think it's obvious once you do it once or twice that that's not what you want, is like music with lyrics. Because you're just going to be really hard to let go and get into that meditative mind space if you're also hearing words come at you. The next recommendation for music, if I had to say number 2, would be ideally longer songs. Like really short, punchy 3-4 minute songs. Those transitions are kind of jarring in the experience, especially as you go farther along and you kind of get into that almost flow state of the psychedelic experience. Every time it cuts to a new song, there's that transition, it kind of brings you back. And so when we make our playlist, we usually start with a couple shorter songs and then build to 2 or 3 longer songs that naturally have a crescendo around 40 to 45 minutes when we know they're peaking. And then we have what's called parachuting down music that kind of it really peaks our music if you listen to it, and
Yeah.
it kind of gently guides them back down. So something more calming.
Yours is really
And so you
good.
can,
Yeah.
it's not that complicated
How
to
did
do.
you come up with your playlist? Because
I just listening to lots of different things in that space. Honestly, you could probably go on Spotify and look up ketamine playlist, and there's probably 1,000 of them, and just listen to the ones that work for you, and you can click on the songs that might grab your attention.
Yeah,
And that's
true.
functionally what I did as well. Basically, pick and choose the things that I thought I liked, because that's all I can really do.
So I would say most clinics are going to have some music.
For sure, yeah.
But some don't. So, I mean, be prepared.
When you did nasal, was there music? Intranasal?
Nope. No
Yeah.
music.
Okay,
Yeah.
I'm curious if that's normal for intranasal.
I don't know.
Yeah.
I don't know if they probably improved things. I mean, because that was
Sure.
2 years ago.
Yeah. I don't know. I can't speak to that because I don't do.
But the other critical thing is have headphones.
Yeah.
And I mean, I guess that you're going to give them at the clinic.
I would suspect most clinics have them.
clinics
Yeah,
have
most
them,
have like
because
a
without the headphones in, all the ambient noise.
Oh, that's a good
is
point. Yeah,
taking it out of the
I'd be
experience.
surprised if there weren't many clinics that were doing that. But yeah, ideally noise canceling headphones.
Yeah.
And then the last thing is kind of the eye mask. Yeah.
Yeah.
Again, most clinics are doing that as well. It's
Yeah.
hard to meditate with your eyes open.
Right.
It's kind of the gist of it. Okay.
Distracting.
In terms of like kind of the last instructions that I give to a patient before they're starting their first infusion, let's say they're plugged in, everything's ready to go, is you're here, you're safe, trust the process, let go, be open.
I love that.
Right? And that's honestly my mantra, and I say it to everyone.
Yeah.
And it doesn't devalue the words. I think I feel very genuine in what I'm saying there, but I think it's important to emphasize that you're safe. Like, I will make sure you're safe here, right? Trusting this process, you have to come in with some level of trust.
Right.
Letting go and being open to wherever it takes you. And then they're off. That's kind of the beauty of it, right?
Yeah.
Like the second that's done, the next time I see them or talk to them is about an hour later.
Yeah.
And I don't know where it's going to go, and it's kind of fun to see where it goes.
So one question based on our role play.
Yeah.
Have you seen a client have a horrible experience the first session?
Very rare. You're right. Yeah.
I mean, has that ever happened?
I mean, horrible. That's a loaded term, but I've seen in really intense first experiences. But I think you're right. That is an anomaly. It's probably less than 10%, if not less than that.
Yeah.
And typically, those are patients that are really deeply into meditation, more on the depressed side of the spectrum, trauma side of the spectrum than the anxiety side of the spectrum, are already like totally primed to let go.
Right.
Maybe even have some recreational psychedelic experience, you know what I mean?
Right.
Like they are,
and it might be
the
too much
fuse is
too
so
soon.
short to just set them off.
Yeah.
Where most of our patients have no recreational psychedelic
And a
experience.
ton of resistance.
So like they're just sitting there and they're just rigid, so you can kind of predict when it's about to get that big. Yeah. Okay.
All right.
I think that's a
covered
pretty good
it.
summary of the things. I'm sure there are other things. You can always, reach out to us if there are other questions about this kind of stuff. We can always do a follow-up podcast. But in general, when we think about the kind of how to prepare for it, this is the kind of the topics that we like to discuss with patients.
Yeah.
All right.